And you've probably heard of palm reading, but today we're going to explore face reading.
Yes, some believe it reveals a lot about your health, your personality, and it may even predict your future. So I had a reading done on your face, Jimmy.
Wait, well, I don't remember signing a release.
Yeah, never mind that. The art of face reading is our featured story at the top of the list.
Face reading goes back thousands of years in China.
It's a great chance for introspection and reflection about what you've gone through in life and how to heal from it.
Scottsdale acupuncturist Kaya Hunter studies the art of face reading. First, she explains how it works. Let's go back to ancient times.
They didn't have any diagnostic tools like we have today, so they had to look at a person to be able to diagnose their health conditions and to try to figure out how to help them.
What exactly on their face are they looking for?
The texture of the skin, the color, the fullness, the emptiness, the wrinkles, the lines, even the eyes and the ears they look at.
Kaya says energy circulates through our bodies.
These channels that are a bunch of myofascial tissue, lymphatic tissue, and nerve tissue that run through different places in the body.
It's believed emotions can affect your energy flow and change your appearance over time. Next, how face reading reveals your life experience. Let's start with Angry 11s.
They're very appropriately named because that's frustration, impatience, anger. The skepticism, which is right above the eyebrow there, so you know when you're skeptical, you're like, okay, sure.
She says disappointment causes marionette lines around the mouth. Happiness creates wrinkles by the eyes. Lines here on the side indicate a sense of loss, and these are due to a loss of a loved one.
Bitterness shows up right here. Over-nurturing, these lip lines.
Finally, how does face reading relate to your health?
Your face is kind of an insight, a mirror into your organs. How does that work?
Your kidney health is up here on your forehead. This is like pancreas, spleen, digestion area, liver, gallbladder. Actually, your eyebrows, the thicker and more beautiful they are, the more healthy your liver is.
You guys know Jimmy, my co-host. Well, he sent along this photo. As you can see, he's being a bit dramatic. He is much better looking in real life.
He wanted to know what we thought about this middle line here, that he says, whether he's happy, sad, asleep, awake, it's always there.
He could have had some sort of struggles going into his 30s that really carved a deep path, and then of course anger and impatience in that area.
Why did you point out his 30s?
That's the area that indicates 30. So each line, each section of your face indicates a different age. So it starts on the ears, so this will be like 1 to 14, 15, and then it starts going down the face as far as your age until you get to hundreds down here.
Jimmy did start having kids in his early 30s, which we all know can be exhausting. As for impatience, Jimmy himself will tell you he's our resident get off my lawn type of guy.
Is there anything that you see on my face?
The happiness lines are what pops out the most. It doesn't look like much disappointment. I mean, you're kind of rocking it. I kind of want to kick you a little bit.
Fun with face reading is at the top of the list.
When you get a checkup, your doctor usually takes your temperature and checks your blood pressure, but Hattie D. Jamal learned there's another way to gauge your health, and it's right at your fingertips.
Our fingers come in handy when getting someone's attention and giving directions, but experts say our fingernails can also point to potential health problems.
For some skin diseases, nail findings can be one piece of the puzzle that can aid in getting a diagnosis.
To learn which nail issues to watch out for, we turn to dermatologist Dr. Leah Swanson at the Mayo Clinic. First on her list, pitting, which is fine pinpoint depressions across the nail.
Pitting can be seen in a couple different skin conditions, including psoriasis and an autoimmune form of hair loss. More frequently, patients are seen for hair loss or a rash, and then we examine their nails and incidentally find this because it's subtle.
Next up, clubbing. That's when the tip of the finger is enlarged, causing an overcurvature of the nail. She says this can happen when your oxygen is low,
like congenital heart disease and also cystic fibrosis. It can also be seen with some systemic inflammatory conditions like inflammatory bowel disease.
And next, a horizontal line across your nail is called a Bow's line. If you have it on one fingernail, an injury probably caused it.
If Bow's lines affect all of the fingernails, more likely there was a systemic cause. Systemic causes could be things like infection, fever, or systemic medications like chemotherapy.
Next, half and half nails are when there is a pale or white discoloration on the nail half closest to the cuticle.
This can be seen in patients with chronic kidney disease. Something else that we see when the white or pale discoloration affects almost the entire nail, that can be associated with long-standing liver disease or liver cirrhosis, and that's called Terry's nails.
Finally, what if your nails have ridges like this? She says not to worry. That's normal.
There can be longitudinal ridging or fissures that occur across the length of the nail. These are usually fairly shallow and they affect all nails to a minor degree, and that can be common with aging.
Dr. Swanson says overall, don't worry too much about your nails.
If there's something that is new and bothersome or uncomfortable to you, then I would bring it up with your maybe primary care doctor or a dermatologist who has a little bit more expertise in the nails.
Scratching the surface of our health through our fingernails.
Welcome back. And when we're feeling the effects of a bad cold or flu, there are a few things worth a try.
That's right. Beyond the basic off-the-shelf remedies or alternatives that may offer some relief.
So here's an idea. Let's send the guy who's terrified of needles to try the IV remedy trend. It was challenging, but totally worth it.
All right, I'm not one for needles, but if I'm feeling sick, I'm willing to try anything to get better.
I think the easiest thing to do is to count to 3, and we're all done.
Wow, I didn't even get to 2.
Family nurse practitioner and owner of Patriot IV in Ahwatukee, Arizona, Andrea Kessler, tells us why more and more prickly patients are now fans of the drip.
Literally mid-infusion, they are completely a different person.
That's because she says absorption rates are much quicker than popping a pill.
It bypasses the digestive system, so that's how it gets absorbed faster.
So although drips can take roughly 40 minutes, the effects are almost immediate. And she says there's a long list of benefits too. They've been proven to clear complexion, help with weight loss, alleviate chronic pain, and boost libido. The number one reason Andrea says patients stop in for a drip? To get hydrated, like if you had a wild weekend.
Does this work for hangovers?
Yes.
Now we're talking.
We actually have a cocktail geared towards hangover cure.
Can you just give me like a margarita directly into my veins?
Sure, why not? Yeah.
For that, saline is used as the base.
Patients that have hangovers, they have headaches, they have nausea, they have vomiting. Just the fluids alone really help people feel revived and energized.
Next up, if you're an athlete and you need some oomph, IV therapy can boost energy with ingredients like vitamin C and zinc.
Our muscles break down every time we do any sort of strenuous activity, so running a marathon, golfers that are out, football players, things like that. So yeah, it actually helps with muscle recovery as well.
And she says strengthening our immune system using lysine and magnesium at the onset of symptoms is the most successful way to beat illnesses altogether.
Somebody's looking at increasing their immune system. We target more of those vitamins that help boost immune function.
Despite all the boosts, there are myths. One of them, she says, is that it costs big bucks.
Is this just for the affluent?
No, it's for everybody.
Most strips start at about $100, and the myth about getting poked being super painful.
And the worst part was the tape coming off.
Yeah, the tape coming off was worse than the needle going in.
So cheers to getting a healthy start in the new year.